Good morning, everyone. I'm really excited right now to share to you the good news that finally the long wait is over. We now have the vaccines against COVID-19. And now we are already conducting the rollout of the vaccination in our country down to the level of the barangays. The COVID-19 vaccine is our only hope. It holds the promise that if we achieve herd immunity, which means that if 70 to 80% of the population will be vaccinated, then we can control this pandemic. Once pandemic is controlled, we can go back to our normal lives. A life when we can freely go out without wearing any mask. A life when we can travel anywhere without any restrictions. Our children can go back to face-to-face education as what is Deped is preparing and pursuing right now. And we will have peace of mind that we will not get infected and get sick with severe COVID infection. Today I am tasked to discuss to you Deped Task Force COVID-19 Memorandum Number 372 entitled Guidance on COVID-19 Vaccination for Deped Teaching and Non-Teaching Personnel. In light of the absence of definitive treatment for COVID-19, especially now that we have these UK and Indian variants that are more transmissible, more deadly, and can cause more severe illness not only to old people but even to young adults and children, it is expected that mortality and morbidity to COVID-19 will continue to increase. When I say mortality, it means death. And morbidity means sickness. Health authorities like WHO and the Department of Health have emphasized that COVID-19 vaccination is one of the major strategies to complement the existing health measures and practices we are doing to mitigate the spread and reduce mortality and morbidity due to coronavirus infection. To give you a background, the Department of Health, through the Task Group COVID-19 Immunization Program, and in consultation with all agencies comprising the COVID-19 vaccine cluster, of which Deped is one of its members, developed a comprehensive plan for deployment and vaccination, and it is called the Philippine National Deployment and Vaccination Plan for COVID-19 vaccines, or NDVP. The NDVP seeks to provide overall operational guidance in the implementation of the COVID-19 vaccine deployment and vaccination program in the whole country. You can Google and search the complete details of this NDVP in the Interim Omnibus Guidelines for the implementation of the National Vaccine Deployment Plan for COVID-19, released as Memorandum Number 2021-0099 by the Department of Health last February 23, 2021. Based on the NDVP, because the production and supply of the vaccines are limited as compared to the high demand for vaccines of the competing nations and the resulting staggered delivery of vaccines in the country, vaccination of people will be according to priority groups. The groupings are as follows. Priority Group A are for the critical population, Priority Group B are for the working population, and Priority Group C are the rest of the Filipino population. Priority Group A, the critical population, is further divided into 5 subgroups. The A1 group is composed of frontline health workers in health facilities or the barangay health workers. The A2 group is composed of senior citizens aged 60 years old and above. The A3 group is composed of adults with comorbidities. They are the 18 years old to 59 years old adults with chronic illnesses. The A4 group is composed of frontline personnel in essential sectors, both public and private, including uniformed personnel like the police and those in working sectors identified by the IATF that are directly client-facing and cannot dutifully meet minimum public health standards. And the A5 group is composed of the poor population based on the National Targeting System for Poverty Reduction, like the 4Ps. Priority Group B is for the working population, and again, it is subdivided into 6 subgroups. And under B1 are our teachers. But this is as of February 23, 2021, during the first release of the NDVP. Thanks to the efforts and perseverance of Secretary Briones, on April 15, 2021, through IATF Resolution Number 110, the priority group categorization of teachers from B1 was adjusted to A4. All workers in basic education and higher education institutions and agencies are now considered as frontline personnel in category A4. Ayan, napakaswerte natin na mula sa priority group B1 na kung saan pang-anim pa sana ang mga teachers ay naiakyat na po tayo sa ika-4th priority group, ang A4. Deped personnel will have 3 levels of participation in the ongoing implementation of the National Deployment and Vaccination Plan. Number 1, as recipients or beneficiaries of the COVID vaccine. Number 2, as members of the following bodies in the vaccination plan. As member of the task group and sub-task groups of the immunization program. Yun po yung mga big bosses natin sa central office at sa regional offices, kung saan member po sila nitong mga task groups. As members of the vaccination team, yan po yung mga nurses, doctors, dentists natin na part ng vaccination team. Kasama sila na nagtuturok, minsan nagka-counseling, minsan nagmo-monitor ng mga pasyenteng for vaccination. And as members of the planning, campaign management, and technical team of the Vaccination Operation Center. Minsan po kasi may mga schools na ginagamit para maging vaccination center. So, mga teachers, school heads nila doon ay maaaring maging miyembro nitong Vaccination Operation Center. And lastly, Deped personnel can serve as champions for advocacy on vaccination. Hindi mo po kailangan maging isang health worker or may background sa health or sa medicine para maging advocate ng vaccination. Sa inyong sariling pagbabasa at pag-aaral about the benefits of vaccination, maaari kayong mag-advocate sa ibang tao para sila rin ay magpa-vaccine. We're going to focus on the first level of participation of Deped personnel. Deped as recipients or beneficiaries of COVID-19 vaccine. It must be emphasized here that the vaccination remains to be the personal and voluntary decision of every personnel. Vaccination is not mandatory. You will not be forced to have a vaccine. But the Deped Task Force COVID-19 enjoins everyone to be proactive in learning about the vaccine and the vaccination program and to make an informed choice about the matter. Now, these are the points or guides that Deped wish to convey to all personnel. Number 1, Deped personnel who wish to be vaccinated are advised to register for free vaccination through their respective LGUs. So, ang LGUs po, through the rural health units, are the lead in the master listing of the respective general population. Uulitin ko po, ang RHU po ang lead sa pagmamaster list ng mga potential vaccinees, hindi po ang Deped. But, here in our division, we wanted to speed up the master listing, and the vaccination of our personnel. So, the school heads and school health personnel will help facilitate the submission of the master list to the LGU by assisting our teaching and non-teaching personnel in filling out the health assessment COVID vaccination form. The form of all elementary and secondary schools will be submitted to the district office, and the district nurse will categorize which priority group they belong to and will coordinate and expedite the submission of the said forms to the rural health unit for inclusion in the master list. Ito po yung health assessment form for COVID vaccination na I'm sure na fill-upan nyo na rin po at saka nasubmit sa mga nurses natin. Another example of this form sa ibang same forms lang yan, same din naman ang laman, pero iba lang ang pagka-layout. CO also sent a health assessment survey form to the field through a link in Google Form, which were answered and submitted online by all Deped personnel. I'm sure nakapag-comply na rin po kayo nito. Siguro konti na lang yung mga hindi pa nakapag-submit at ifa-follow up na lang po yan ng mga nurses natin. So the purpose of that survey is to know the health profile, determine the number of Deped personnel who are willing to be vaccinated against COVID-19, their priority group, and to know if there is enough supply of vaccines from the LGU for our Deped personnel. Number 2, Deped personnel are advised to take note of which priority population group they belong to and register accordingly. So kanina po ay na-discuss ko na yung A1, A2, A3, A4. Hanggang A4 lang po tayo. So in general, all Deped personnel ay nasa A4. But personnel are reminded that if they fit the criteria for higher priority groups, A1 to A3, yung A1 po yung mga health personnel, A2, senior citizen, A3, non-senior citizen but with comorbidities. If you fit in the A3 or A2 or A1 group, you don't need to wait for rollout for the later priority groups. Mas mauuna po kayo. Instead of waiting for the A4 group, pwede na po kayong mauna if you fit the criteria for senior citizen as A2 or non-senior citizen but with comorbidities sa A3. Now, these are the frequently asked questions on priority eligible group A3. I'm sure marami po kayong mga tanong tungkol dyan. So, pin-prepare ko na rin po ito. Who are included in priority eligible group A3? This group includes adults 18 to 59 years old with controlled comorbidities, not included in A1 as frontline health workers or as A2 senior citizens. Okay po? Who should be prioritized among A3 adults with comorbidities? Hindi po lahat ng may sakit ay considered as A3. Ang mapaprioritize po ay ito, Filipinos 18 to 59 years old with any of the following clinically controlled comorbidities. Yun po yung may mga chronic respiratory disease, hypertension, cardiovascular disease, chronic kidney disease, cerebrovascular disease, like yung mga na-stroke, cancer or malignancy, diabetes, obesity, chronic liver disease, neurologic disease like mga epilepsy or seizure disorders, tuberculosis and chronic respiratory tract infection, immunodeficiency states. Again, hindi po lahat ng may sakit na wala dito ay mapaprioritize. Mga sakit po ito na chronic. Yun po yung lifetime na sakit na. Kung ang mga sakit po ninyo ay mga UTI lang, acute UTI, at wala po yun dito, hindi po yan siya considered as comorbidity. Why do we need to prioritize persons with these controlled comorbidities? Persons with these comorbidities are prioritized because they are among the top causes of morbidity and mortality and would have higher risk of having severe COVID-19 if they get infected. Who among Group A3 will need medical clearance? Person with any of the following comorbidities will need a physical or electronic medical clearance from their attending physician. Those with autoimmune disease like lupus, human immunodeficiency virus or HIV, cancer or malignancy, transplant patients, those undergoing steroid treatment, and patients with poor prognosis or are bedridden. Those persons with other comorbidities not mentioned above do not need a medical clearance before vaccination, but should show any proof of comorbidity and undergo screening on vaccination day. Where can I get medical clearance? You can get your medical clearance from your attending physician through teleconsultation, consultation at designated facilities, rural health units, or other primary care centers designated by the LGU. LGU shall ensure that mechanisms to provide medical clearances to A3 are accessible and available to all members who may need it. Ano po yung medical clearance? Ang medical clearance ay iba po sa medical certificate. Sa medical clearance, nakalagay po doon na this is to certify that Mr. Blank 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 is a known lupus patient and is cleared for vaccination, COVID vaccination. Ganun po nakalagay dapat ang wordings na yon. Cleared to receive COVID vaccine. Ang medical certificate naman po, nakalagay lang doon ay diagnosis ng isang pasyente. For example, this is to certify that Mr. Juan de la Cruz is a known hypertensive and is on medication. Yun po ang pinagkaiba. Ang clearance ay para sa mas malalang mga sakit. Ang certificate ay para lang sa may mga ordinaryong mga comorbidities. If I don't need a medical clearance, do I need any other documents? Yes, those persons with other comorbidities not needing medical clearance should show any proof of comorbidity. This is to ascertain their eligibility as part of A3. Kailangan po nating magbigay ng proof kasi po may mga instances like sa Manila na syempre kulang nga po yung vaccine and by prioritization nga ang nangyayari, maraming mga tao na nagpapanggap na meron silang sakit. Sasabihin nila may high blood sila, meron silang diabetes, kasi gusto nilang mauna. Parang takot na takot sila na maubusan ng vaccine. So, para maiwasan yun, kailangan nating magbigay ng proof na meron talaga tayong ganong klaseng mga comorbidity. What can I present as proof of comorbidity? Proof of comorbidity can be any of the following. Medical certificate from your attending physician. Take note, sa attending physician po kayo pupunta. Sa doktor nyo po. Huwag po kayo mag-shopping ng doktor. Kasi baka mas kilala ng doktor nyo kung ano ang mga health history ninyo. Kung magsha-shopping kayo ng doktor just for the reason na magkaroon lang kayo ng certificate, ay hindi po yan safe. Baka may mga bagay na ma-miss ang doktor na yon na lalong ikakasama ninyo. You can also provide as proof yung mga prescriptions for medicine, mga reseta, mga lumang reseta nyo, na meron kayong ganito yung mga maintenance nyo. Tapos, hospital records such as discharge summary, medical abstract, surgical records, pathology reports. Medical clearance is not necessary prior to vaccination for this subgroup. You only need medical certificate if you have an ordinary comorbidity. So in this slide, naka-itemize po dito yung mga comorbid conditions for you to be considered in the H3 group. Sa chronic respiratory disease and infections, yun po yung mga asthma and respiratory allergies, COPD, interstitial lung disease, cystic fibrosis, pulmonary hypertension, PTB, chronic bronchitis, bronchiectasis. Sa cardiovascular disease, ang example po nun ay hypertension, coronary heart disease or ischemic heart disease, yung may mga bara sa puso, cardiomyopathies, enlargement of the heart, peripheral artery disease, aortic diseases, rheumatic heart disease, congenital heart disease. Also, yung chronic kidney disease. Yun po yung may mga pataas ng creatinine dahil sa mga complication ng iba pa nilang sakit ng tulad ng diabetes. Pero yung mga acute infections like acute urinary tract infection, acute cystitis, it's not considered as chronic kidney disease. Tapos, cerebrovascular disease, example nun ay mga stroke at saka yung transient ischemic attacks, yung stroke na nakaka-recover agad. Yun yung TIA na tinatawag. Tapos, yung may mga cancer or malignancy. Diabetes, obesity, neurologic disease such as dementia, Alzheimer's disease, yung mga nag-uulianin, Parkinson's, epilepsy, seizures, Bell's palsy, Guillain-Barré syndrome, or acute spinal injury. Mga chronic liver disease naman ay yung may hepatitis, cirrhosis, non-alcoholic fatty liver disease. Diba po marami sa inyo, pag nagpapa-ultrasound, ganyan yung findings, fatty liver. So, pwede na kayong makonsider as H3 group. Number 10, yung immunodeficiency states. Yung mga mababa ang resistensya. Tulad po na may mga sakit sa dugo, yung may leukemia, HIV, yun po. And other diseases such as sickle cell disease, thalassemia, or Down syndrome. Again, the priority group A3 is required to present to the vaccination team documents or proof of their comorbid health conditions. Deped personnel are enjoined to keep themselves updated about the latest guidelines from the DOH about vaccination, especially on eligibility, deferment, and the requirements for medical clearance and certification, among others. For proper guidance, you are advised that you should only read or check on DOH issuance and updates. Huwag po kayong maniniwala sa mga pinapasa sa messenger na mga fake news kasi lalo lang maliligaw kayo doon. Mas mabuti po magbasa po kayo ng mga scientific or medical na mga journals or updates para mas maliwanagan kayo about the benefits you will get if you get vaccinated. Deped personnel are enjoined to rely only on the post made by official sources such as the DOH Facebook page, yung Res Bakuna, and to ensure that it is the most recent or updated post or issuance. Deped personnel are instructed to keep a record of their vaccination details for future reporting within Deped. Sa ngayon po ay gumagawa na ang Deped ng database for the record of the immunization status of all Deped employees. And nagsisimula na rin po kami ngayon dito sa division office. So yan po ang reason kung bakit nagpasagot kami ng mga survey forms sa Google. And ang mga nurses ay aktibong-aktibo sa follow up sa inyo para alamin kung kayo ba ay nabakunahan na, kung kailan, at kung anong brand ng bakuna. Kasi every now and then ay i-encode nila yon sa aming centralized na database dito sa Division Office. Deped personnel are reminded to continue to strictly observe the required health standards before, during, and even after vaccination. Kahit nakapag first dose ka na, kahit nakapag second dose ka na, you still have to practice these health protocols. The only time na pwede ka na magtanggal ng mask is when we already achieve herd immunity. Herd immunity is when 70 to 80% of the population is already vaccinated. And ma-achieve natin ang herd immunity kung tayong lahat ay magkipag-cooperate, magpapavaksin. Hanggat may mga taong hesitant at ayaw magpavaksin, magpapatuloy pa rin tayo nito sa pagsunod nitong health protocols. Magpapatuloy pa rin ang mga restrictions. So, sana po makapag-isip-isip kayo kung ano bang mas makakabuti para sa sarili nyo, para sa inyong mga anak na hindi pa na-vaccinate, para sa inyong mga estudyante na hindi rin na-vaccinate pa, at para sa buong bansa. Nakasalalay po sa atin ang desisyon. At sana ay magkaroon kayo ng magandang desisyon tungkol dito. Deped personnel are assured by the Department of Health that any adverse event following immunization shall be properly managed. The AEFI refers to any untoward medical occurrence which follows immunization and which does not necessarily have a causal relationship with the usage of the vaccine. AEFIs are classified as a notifiable health event of public health concern. The healthcare providers who administer the COVID-19 vaccine to recipients, yung mga RHU doctors, are in charge of regularly monitoring AEFIs among those individuals up to 1 year after vaccination. So, wag po kayong mag-alala because up to 1 year after vaccination ay imo-monitor po kayo ng health department and even ng mga Deped health personnel. So far naman, nung kami ay na-vaccine, araw-araw tinatawagan po kami ng RHU doctors and nurses namin dito, tinatanong, kamusta? May side effect ba kayo? May nakaramdam ba kayo ng mga chills, lagnat, pananakit ng katawan? Kinakamusta niya kami. At ina-assure din niya kami na in 3 to 5 days, mawawala din yun. Yung mga naramdaman namin ganon, na mga side effects. And true enough, ganon nga. Talagang ganon. In just 3 days, nawala na. Ang iba pa nga namin ditong kasamahan na mga nakatanggap ng Sinovac, halos wala talaga silang naramdamang side effects. And considering na mga senior citizens pa yun sila. So, masasabi ko lang po na kapag nagpa-vaccine kayo po ay aalalayan ng maayos ng ating health department. Hindi po tayo pababayaan. At wag niyo pong isipin na hindi ito safe. Dahil hindi ito ilalabas sa market. Hindi ito ibibigay sa tao kung hindi ito napag-aralan na talagang safe sa tao. Nakapag-undergo po ito ng 3 clinical trials, phase 3 trials involving halos puro mga public health workers, mga doktor yan sila, mga nurses, lahat ng nagkatrabaho sa hospital. Sila po ang naging guinea pig ng mga vaccine pharmaceuticals. Silang unang binigyan ng vaccine na yan at fina-follow up. And so far, na-prove naman talaga na itong mga nilabas na vaccines natin ngayon ay approved as safe and efficacious. So, kung may nagtatanong po sa inyo, kung mababa lang naman ang efficacy ng vaccine na katulad ng Sinovac, 50% lang naman, bakit pa ako magpapavaksin? Ang masasagot ko lang po dyan, ang 50% na efficacy or protection na mabibigay ng Sinovac ay malaking bagay na kesa sa zero. Kesa sa walang-wala ka talaga kapag hindi ka nagpa-vaccine. And hindi lang 50% lang yon na hindi ka magkakaroon ng COVID. Pero ang findings ngayon ay 78% ng nabakunahan ng Sinovac ay hindi makakaranas ng moderate to severe COVID infection kapag sila ay nahawaan. So malaking bagay na po yan. May assurance na po yung vaccine na malayo tayo na ma-ICU, malayo tayo na mamatay, malayo tayo na maging abo. So, yun po, sana mapag-isip-isip ninyo at mag-research kayo sa mga reliable sources sa internet about yung mga vaccine status, vaccine studies about COVID. May mga iba po sa inyo na hindi pa rin naniniwala about COVID. Sabi nila, ano lang yan, scam lang yan, trangkaso lang naman yan, sinasabi na nilang COVID. Kung hindi yan COVID, paano nyo ma-explain ang nangyayari ngayon sa India? Kung saan 3,000 plus na tao na araw-araw ang namamatay. Meron bang trangkasong papatay ng 3,000 sa loob lang isang araw? Ilang araw nang nagkakaganyan? Ilang araw na bang nangyayari yan sa India? Ilang libong tao na bang namatay ngayon? Meron bang trangkasong ganyan? Di ba po wala naman? Hindi ganyan ang trangkaso. Ngayon, kung sasabihin po ninyo, ilan ang namatay sa Pilipinas dahil sa COVID? 16,000? Maliit lang naman yon ng 16,000. Kung isipin nyo, maliit lang yon. Pero ang 16,000 na yan, tao yan. They are people that we used to know. Some of them could be our relatives. Some of them were our friends, our classmates. Hindi po maliit na bagay. Kahit isang tao lang na mamatay sa COVID ay malaking bagay na. Dahil ang taong yon, hindi ninyo alam, ay maaaring isang ina, isang ama, isang kapatid, isang breadwinner ng pamilya, at kawawa naman ang mga naiwan niya dahil naging biktima siya ng COVID infection. Yung tungkol po nangyari sa India, for your information, ang India po ay isang manufacturer ng vaccines. Sila ang nagmamanufacture ng AstraZeneca, ng Bharat, ng Novavax. Manufacturer sila, hindi nila kailangang bumili ng mahal, hindi nila kailangang i-transport galing sa ibang bansa yung vaccine. Doon mismo sa kanila may vaccines na. Nagbebenta pa nga sila sa other countries. Pero bakit nangyari yun? Alam niyo po kung anong dahilan? Nangyari yun dahil sa vaccine hesitancy ng mga tao. Number 1 yun. Ang tagal nilang magpa-oo. Ang tagal nilang mag-vaccine. Number 2, ang bagal na ng rollout nga ng vaccination. Ang kanilang mga health workers ay hindi masyadong committed na bilisan ang pagpapavaksin. Number 3, ang mga tao ay hindi sumusunod sa protocols because even their leaders, the president, allows them to have gatherings, yung mga political rallies, mga religious events, inalaw nila yun. Kaya ang mga tao nagkumpul-kumpulan, ayun, nagkalat tuloy ang virus. So, wag po sana mangyari sa atin ang katulad ng nangyari sa India. Ngayon, nandito na yung vaccine, wag na nating patagalin pa ang pagpapavaccinate sa ating sarili. Ito lang yung paraan para ma-stop agad yung pag-spread ng virus. Alam niyo po yung game na pass the message. Kung saan mayroong halimbawa 10 tao nakahilera. Sasabihin mo ibubulong mo yung message mo sa unang tao, ibubulong niya sa susunod hanggang sa dulo. Di ba po sa pass the message, minsan pagdating sa dulo, yung message na una mong sinabi, naging iba na. Ganun po yung logic na nangyari sa COVID variants. The more na maraming pinapasahan yung virus, the more na natatransmit siya sa iba't ibang tao, by the time pumunta na siya sa ika-100 na tao, ay iba na siya, nag-mutate na siya, naging COVID variant na siya. Mabuti lang sana kung pag-mutate niya ay naging weaker virus siya. Paano kung naging mas matapang siya na virus katulad ng Indian variant na mas transmissible and mas deadly? But with vaccination, kapag lahat ng tao or karamihan sa tao ay vaccinated, mai-stop mo ang transmission ng virus sa iba't ibang tao at mai-stop mo din ang pag-mutate ng virus para maging COVID variant. The vaccines really work. If you are waiting for the best vaccine, ang masasabi ko po dyan, the vaccines that we have right now is the best vaccine. Do not wait for this ideal vaccine that you are dreaming of. What we have right now is already the best. Ang pagpapadelay mo para magpa-vaccine ay maaaring maging mitsa pa na magkakaroon ka ng COVID infection at mamatay. So, kung nag-aagam-agam po kayo na baka ang vaccine ay papatay sa'yo, hindi po. Tumingin po kayo sa amin, na mga nurses, mga school health personnel. Kaming naunang na vaccine. And hanggang ngayon, buhay pa rin kami. We are a living testimony that the vaccine is safe. That the vaccine is effective. Meron po kaming nakitang post from one of the doctors in Odjongan, si Dr. Magbanwa. Naka-public naman yun. So, maybe she really wants everybody to know na after vaccination, nag-experiment po siya or nagpa-test for antibodies. Diba po kaya tayo nagpapa-vaccine in order to form antibodies which will fight against the virus. Pagpa-testing po niya ng COVID vaccine, pagpa-test po niya sa antibodies, positive na po siya sa antibodies. Ibig sabihin, after the vaccination, naka-form na siya ng antibodies, protected na siya. Diba? Pero until now, kahit protected na siya, alam na niya sa sarili niya, masaya siya, still, pag nakita niyo siya, lagi pa rin siyang sumusunod sa health protocols. Pag pumupunta siya sa hospital, tumitingin ng pasyente, naka-full PPE siya. Because the vaccines says that it will protect you from getting severe infection. But there's no report yet that it will prevent or avoid transmission. Diba? So, pwede ka pa rin magkaroon ng infection, yun nga lang, asymptomatic lang or mild lang. And pwede pa rin na pag ikaw ay merong current infection na hindi mo alam, pwede mong mapasa sa ibang tao na unvaccinated. At sila naman ang magkaroon ng severe infection. Siyempre, hindi mo alam. But, through my readings, kasi po nagbabasa din ako ng mga ganyan, lagi ako nagbabasa ng mga journals, medical journals, may mga initial report na po ang mga vaccine companies na sa mga fina-follow up nila ng mga subjects na na-vaccine nila last year pa. And most of them talaga ay mga health workers. Ang pamilya ng mga health workers na yan ay halos hindi na nagkakaroon ng COVID infection as compared to the children or families of other people na unvaccinated. So very promising na ang initial result nila, na hindi lang nila nalalabas pa, hindi pa nila pinapublic yung ganong, ina-announce yung ganong findings, because they still need time and more study in order to make a more conclusive result. Naisip kasi nitong mga scientists natin na maybe because dahil health workers sila, mas careful sila, pagdating nila ng bahay, talagang bihis agad at saka nilalabahan yung mga damit na sinuot nila galing hospital, kaya yung mga anak nila ay hindi na natatransmitan ng virus. Baka ganon. So, humingi pa sila ng additional time and para makakonclude sila ng ganong findings na kung talagang nga bang in general ay talagang hindi na nakaka-transmit ng virus kapag ikaw ay vaccinated. So hopefully, sana nga ganun. But as of now, our goal is to protect ourselves, protect us from getting severe infection. And at the back of our mind, with the hope na hopefully kung magkaroon man tayo ng infection, ay maging asymptomatic lang or mild at hindi na natin mahawaan yung mga anak natin na hindi pa vaccinated. With the rate that the vaccination program is going on, ang sabi, it would take more than 5 years before we can be able to vaccinate all people here in the Philippines. Ang tagal pa ng 5 taon. So, kailangan na nating bilisan. Kaya nga po kami dito sa Deped, sa mga health personnel, i-assist po kayo para mapadali natin, ma-speed up yung vaccination program. Dahil ang time ay mahalaga. Mahalaga ang time. Sa ilang oras na yan or ilang araw na yan na dinidelay mo ang pagpapavaccine sa sarili mo, binibigyan mo rin ng time ang virus na ma-infect ka. So, yun lang po. I hope nakapagbigay ako sa inyo ng magandang message. And hopefully sana maging 100% ang ating acceptance sa COVID vaccine. Thank you very much and take care and keep safe. God bless us all.